So, good morning. Today we are discussing the important concept of the 8 straightforward lollipop names in psychiatry, popular names and MCQ names in psychiatry. And the scientist name it is basically which talks about the name of the scientist they commonly asked you in psychiatry. So, I am Dr. Sandeep Govil with the code of Dr. Sandeep-YT. So I start the learning of the names of scientists in psychiatry, which are free marks MCQs. I call them lollipop MCQs because if you know it, it will be a straightforward question. So we are running a foundation batch, capsule batch for the NEET PG 2021 and foundation batch we are running for the 2022. We are discussing in detail all the theory. My Telegram channel is the Psychiatry Made Easy, and we are conducting a special free classes every 10:30 p.m. on Tuesday, Thursday, and Saturday. YouTube, we are discussing all the 5 MCQs in 15 minutes. So that's a brief about us, and this is about our program at Unacademy, where you can access the free live learning from 5 p.m. onwards to 11 p.m. Every hour we have a different educator teaching the different topic and thereby the MCQs of the NEET PG. And you can join simply it by a very cheap price of 22,500. You will get a discount of 10% if you apply my referral code, and you can still get this divided into the EMI by various bank options. So learning has been made simple on this platform called Unacademy. Affordable, simple, quality learning for every student who wish to crack the exam. So please join us to crack the exam. So in the YouTube session we have a YouTube of image base, question base, concept base, and we have the pre-intern series by Dr. Sanket and the subject-wise quizzes, the syndromes, the flashcards. We have the throwback and previous year questions and PG quiz and the clinical MCQs, image-based MCQs. So it's a free classes happening and that's a YouTube happening. We are running a foundation batch, capsule batch. So we today enter now the class of the topic today. So we have these 8 names or 10 names, we'll learn 2 more to start with. We know the father of psychiatry or psychoanalysis we say is the Sigmund Freud. And so that's what is the first name we learn. We know he was the professor of neurology in his country. He given the dream analysis and concept of the psychoanalysis, understanding the character of the client by the unconscious thought process, and psychodynamic psychotherapy. Psychodynamic is nothing but the mini version of psychoanalysis. So they ask you a lot of questions that he was professor of neurology, then the father of psychoanalysis, and he given a concept of the dream analysis and psychoanalysis and a mini version of which being called as the psychodynamic psychotherapy. Simple MCQ father of psychodynamics or psychiatry is the Sigmund Freud. Then there come a heroic move of psychosurgeries. So frontal lobectomy has been done for the patient with schizophrenia, and the caudate lobe excision can be done for the cingulotomy, can be done for the cingulum gyrus has been taken away. Cingulotomy has been done for the process of OCD. First time been done by Lima and Moniz, and they received first time a Nobel Prize in psychiatry for any treatment of psychiatric illness. Lima and Moniz got the Nobel Prize in 1938. They do the frontal lobectomy for schizophrenia and cingulotomies, leucotomies for OCD. Then the Nobel Prize was won by the Nobel Prize 1939, been won by the Cerliti and Bini. They actually introduced the electric shock in psychiatry by the observation that seizures improves psychiatric illnesses. There were attempts to induce seizure by many means. First of all, camphor has been tried, we all know, to induce seizure, but it has lot of local complication. So we then introduce the electric shock for the seizure. Today we know we also introduce the seizure by the magnetic shock. And Cerliti Bini introduced the electric current for inducing a seizure, and they use the 90 to 120 volt of current for 0.9 to 1.2 second. And in this, I must have a seizure for 15 to 20 seconds. The motor seizure should happen within this limit of 15 to 20 seconds, but nevertheless, we are learning about the inventor of the electric shock in psychiatry. It is Cerliti and Bini in 1939. Then Behaviour therapy has been introduced by the Skinner, and he is the master of the operant conditioning, or what is being called as the instrumental learning. So according to him, any behavior we know can be increased and any behavior can be decreased. Increased by the reinforcement, which could be positive, which could be negative, and decreased by the punishment and time out, removing the person from the stimulating environment. But please mind, reinforcement, whether positive, whether negative, will increase the desirable behavior. So that's what we must be learning from this topic, that reinforcement, whether positive, negative, but increase the desirable behavior, and the father of behavior therapy is Skinner. Then comes the Aaron Bank, who is the father of the cognitive behavior therapy. He given that all psychiatric illnesses are a result of the faulty ideas and beliefs. And he by therapy tried to, and he named as a cognitive distortion. And he tried to correct the cognitive distortion by his cognitive behavior therapy. He identified the three negative cognition in depression. First is the negative view of self, future, and environment. So this is the classical three negative triad he given for us. In depression there is a negative triad. I am waste, my future is waste, and environment is already waste. So this need to be correct in the first time he given for depression. Now we know we use this behavior CBT for everything in psychiatry. And the man behind the CBT is the Aaron Beck. Okay. Sorry. Then we have the go to 1904, where the world has been struggling with psychosis, and psychosis has been first time classified by Mr. Emil Kraepelin, scientist or doctor, and he classified psychosis into the relapsing, remitting illness with a good prognosis and chronic debilitating illness with a poor prognosis called dementia precox. MDP is a manic depressive psychosis. So that's all about the psychosis, and that's about the Emil Kraepelin. He first time classified the psychosis into MDP and dementia precox. So this is a popular MCQ in Indian examination, that the term dementia precox is being given by Emil Kraepelin. Then we know the term schizophrenia is being coined by Eugen Bleuler. He sets a split mind, and he given the 4 A's of schizophrenia, namely autism, ambivalence, affective blunting, and autism, ambivalence, and associational loosening. So 4 A's he has given for the schizophrenia. Associational loosening is that there is no connection between my two successive thoughts. Affective blunting is my emotions are being blunted, and the person is ambivalent for all each of his action. It's ambivalence. And autism is the autism of our childhood days now. That is what is the autism described first by him. So very popular MCQ. The term schizophrenia been given by Eugen Bleuler, and he coined the given the 4 A's of schizophrenia. Difficult to be understandable by common man. If you tell the family member that he is having a schizophrenia and he has autism, ambivalence, and so on, nobody will understand. So science has to classify the symptoms of schizophrenia into the positive and negative symptom later in 1980s. And he say that science says that to be understandable by common man, something extra in me will be called as the positive symptom. Delusion, hallucination, violence is a positive symptom. Something extra in a patient of schizophrenia than a normal person is being called as the positive symptom. Negative is what all a normal man have, they don't have. It's a negative symptom of schizophrenia. So we all have motivation to live, they have a motivation. We all enjoy the pleasure. They have anhedonia. They can't enjoy the pleasure. We all socialize, we all make friends and create enemies to live happily in this world. They don't believe in, so they are asocial. They have asociality. We all speak language. They do not speak at all. That's a, or they just speak 5 words per day. There is absence of language. It's a logia, and we all have attention to focus. They have attentional deficits, and they have the affective blunting. We all have emotions to display, but their emotions are being blunted. So today we understand schizophrenia into the positive and negative symptom of schizophrenia. But the term schizophrenia being coined by Eugen Bleuler, who classified them as the 4 A's of split mind: autism, ambivalence, affective blunting, and associational loosening. So that's a Bleuler sub for the schizophrenia. Now that's the latest MCQ. The McDonald triad is of a sociopathy triad. He says the child is only gunda, and you have to, if you don't intervene, and you can only intervene by the family therapy. And what happened in this? Fire setting, passing urine at night, and we have the torturing small animals. They torture the small animals. So this is a triad. So if you intervene here by family therapy, the child can go back to normalcy. But if you fail here to improve the family structure or family pattern of interaction, the child will surely go for a sociopathic or antisocial man. That's the 8 name we have just listed. But we know we commonly be not to forget the Jean Piaget concept of the cognitive development in psychiatry. Cognitive development of a human being or a person. Then we all know there is MCQ about the Erik Erikson describing the social theory of development. That it's a social theory of development. We know first of all Freud Sahib has given the theory of the unconscious mind by the psychosexual impulses. So today we have the now better versions, but these were the primitive way of understanding the human psychology. Freud tried to do that by unconscious mind. Jean Piaget, being more scientific, talks about the intelligence and the cognition of a development of human stages. And Erik Erikson included the social component, that it's a social component which is much more responsible for my development and my personality development. So we have now 9 number Jean Piaget and 10 number is the Erik Erikson. So these are the list of scientists I think we must know in psychiatry. So I thank you so much for joining us for the lecture, and I invite you once again to join us on the platform of Unacademy. And if you join us with my code, we all will get benefit. You will get discount 10% and it will be a name at my institute for me. So thank you so much for joining us for the name of scientist in psychiatry. So these are all MCQs, straightforward MCQs. I again call them as a lollipop MCQs. So thank you so much. All the very best.